Hi, my name is Srinivas Sudika and I'm a computer engineering graduate with over 3 decades of experience in IT industry in various key managerial senior positions. I worked in various multinational companies and I have left my corporate career to pursue my entrepreneurial dreams. So, I'm the founder of a healthcare startup by name Thamsar, which is registered in Hyderabad during 2021. So, Thamsar is an acronym for Telehealth and Medical Services in Augmented Reality. So, we want to leverage technology for delivering healthcare services to the people of India. So, you might be wondering why provide telemedical services to people in India. As a matter of fact, over 65% of Indian population they live in rural areas. And in rural areas, the living conditions or rather the infrastructure is not up to the standards. As a result, there is huge difference between urban India and rural India. Most of the healthcare facilities are concentrated in urban areas. So whenever a person in rural area falls sick, whenever he has to have some kind of healthcare or medical care services, has to either travel to these cities or towns nearby urban centers, or they have to depend on the medication provided by the ill qualified, underqualified, unauthorized medicinal practitioners called RMP doctors. So, if they have to undertake a medical trip to the urban area, they have to incur additional expenditure in terms of traveling, in terms of lost working hours, in terms of lodging and boarding. So, in order to prevent this kind of additional expenditures, most of the people they tend to procrastinate their medical trips and they resort to RMP doctors, the treatment that the RMP doctors provide. So, these RMP doctors they risk the lives and the health of the patients because they are not authorized, they don't have any strong medical educational or other practices. This is the situation in the entire country. As a matter of fact, we can say that these RMP doctors they outnumber the real medicinal practitioners. Means they are running a parallel medical system in India which is unauthorized. So this is one problem that we need to eliminate. And the second problem is that healthcare services should be made available, accessible and affordable to all the people irrespective of their geographical conditions, geographical constraints and their financial limitations. So we have developed a solution where we can deliver healthcare services even to the people who are living in remote areas with ease. Means we are able to do it with telemedicine technology. So we have developed a software system where doctor and the patient can interact online on a video based chat. Not only that, we have integrated our telemedical system with point of care medical devices for testing patients condition. These devices they capture the real-time clinical condition of the patient and then upload to the cloud which can be accessed by the remote doctor. So that is how we are actually overcoming the lack of in-person consultation. So as you know, most of the people in rural areas they are not educated enough to operate the system on their own. So for this we have developed a different kind of solution. So we have come up with the concept of digital clinics, community digital clinics, which will be operated by trained medical person. He could be an RMP doctor, he could be a nursing professional, or he could be a paramedical professional who would be trying to handle the patient and the telemedical system. He acts as an interface between the local patient and the remote doctor. That is how the patient can be examined for diagnosis and he can be treated. So this is what we are trying to accomplish. So initially we are trying to set up a cluster of digital medical clinics in one area in Andhra Pradesh And then once the process is fine-tuned and once the process is standardized, then we want to replicate this model across India through franchising. So the main business that we are going to do is we have to provide franchising to this thing. So you might be wondering how the system will work. See, a medical specialist who wants to provide any consultation, medical consultation, they can register themselves in the system and they can set up their own virtual clinic by specifying their available hours, by specifying their consultation charges, and then they can also talk about their specialization, what kind of services they provide. So that is how the medical specialist will empanel with our system. And then when a patient wants to have consultation, he has an ample choice. He can choose any doctor of his choice who are empaneled in the system. He can specify his own criteria saying that I want a medical consultation with less than so and so money. Like for example, you can say that okay, I want a consultant who charge 300 rupees. And he can actually specify like the language that he wants the consultant to speak. Like that, he can give his own criteria and the system will generate the list of medical specialists to meet the criteria, and the patient can actually request consultation from any of the displayed doctors. And after charging the patient with the consultation fee online, the system will enable the consultation process between the patient and the doctor. So the DMP acts as an interface between the local patient and the remote doctor. Means we have already told that okay, we have integrated the system with various medical devices, point of care medical devices, and all the readings, the real time readings, the clinical vitals of the patient can be captured, and then it will be uploaded to the cloud under the patient account, and this information can be accessed by the medical specialist online in real time. So he can make an informed decision like for deciding the line of treatment and whatever it is. That is how we are actually trying to establish this thing. Digital clinics are of two types. One is a simple digital clinic containing only the telemedical kit, and the other one is an advanced version of the digital clinic which contains even the pharmacy and also the laboratory. So this is how we are trying to reduce the dependency on the nearby local urban areas or on the RMP doctors. So in this context, we are actually trying to take support of the venture capitalist. We are also trying to have collaboration with various stakeholders like hospitals, doctors, diagnostic centers, and various other stakeholders. So that is how we want to actually run our business. So my appeal to you is that if you are interested in this business model, please do join hands with us and let us make this a reality. So healthcare is no longer going to be a very, very difficult thing for people living in rural Indias. One question you might be asking is about the government hospitals. You might be asking like why the government is not doing. It's not that the government has got its own machinery, their own setups, but unfortunately this machinery is not effective. The reason is most of the doctors doesn't prefer working in hospitals because of the poor living standards in villages as well as the poor infrastructure in the hospitals. So you have to understand the fact that over 85% of specialist positions in government establishments are vacant. So if you look at the problem is nearly 2.4 million people die in India annually with reasons which are preventable with proper medical care in the right moment. So this is the issue that we are trying to address. So please do join us in our efforts to change the healthcare system in India. Thank you.